everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT With Me, which is an NPTE prep platform. If you enjoy what you see, check us out at sptwithme.com when you're studying for the NPTE. Now, for what you're actually here for, let's talk about Cranial Nerve IV, the trochlear nerve. In this particular image, we are looking at the thalamus and brainstem in an anterior to posterior point of view. Now, the trochlear nerve almost looks like it is coming out of the superior aspect of the pons. Now, this is exactly why it's important to see multiple images, because the trochlear nerve does not come out of the anterior aspect of the brainstem. It comes out of the dorsal posterior aspect. Here's a different view of the thalamus and the brainstem. This is where you can actually see the true anatomy of how the trochlear nerve actually exits the brainstem. As you can see, it exits the posterior aspect of the brainstem. This is a zoomed in version of the previous image. I know it's a little bit difficult to see black and white, so hopefully this provides a little bit more clarity for how it actually looks. As you can see, it comes out of the midbrain. This is a lateral view of the same structure, thalamus, brainstem. Here you can see that the nerve wraps around ventrally because we need to make our way to the eye. So to get a clear picture about how the pathway is actually traveling to the eye, we see the left image. We see that the trochlear nerve comes out of the dorsal aspect of the midbrain. It wraps all the way around until it crosses the superior orbital fissure, which is a hole within the skull. And then it makes its way to the muscles that it innervates. In particular, it is one muscle. It's the superior oblique muscle. As you can see, this muscle itself looks a little bit odd. So it actually initially goes in the same direction as the medial rectus muscle, but it then ends up taking a turn through a pulley system. It makes a pretty angular turn if you look at it. Then it connects to the eye. So this pulley system is actually called a trochlea. That's where its name comes from. Here's another view of that muscle. This is a top-down view, so a transverse cut, so we can look from a superior to inferior view. So I was mentioning before, you can compare the direction of the fibers between the superior oblique muscle with that of the medial rectus muscle. And you can certainly see that there is kind of the same direction up until the superior oblique muscle reaches the pulley, the trochlea. When it does reach the trochlea, you can see that the pulley is going to make it wrap around and end up taking a very sharp angle in which then the muscle actually connects to the eye. So when you think about the movement that the superior oblique muscle causes, when it's activated, you could see the direction of pull. It creates a rotation. The rotation in particular occurs in a medial fashion, where the top of the eye is going to rotate toward the midline. So as an example, if you look at this image, this depicts the right eye. So activation of this muscle is going to make the eye rotate down and to the left. Of course, vice versa for the other eye. Now, aside from showing you, just how the muscle looks, I definitely think it's helpful to understand what a trochlea is. That way you can understand why the nerve is even called the trochlear nerve. Now, consider that there are other parts of the body called a trochlea. So think about your elbow. It's the same exact idea. Its name is because of the function, the pulley. Cranial nerve IV is a purely motor nerve. Its only job is to activate the superior oblique muscle. This muscle has two functions. Number one, it moves the eye in the direction towards depression as well as intorsion. Now, I know it sounds counterintuitive because how come a superior named muscle is making the action of depression? However, again, look at the angle, look at the pulley mechanism. The direction of the pull is going to make the top of the eye rotate inwards and toward the nose. So you look medially and down. The way that you can assess this particular nerve is through one of the components of the H-test. To keep it simple, the H-test is essentially having your patient sit, they're going to keep their head straight, and you're going to ask them to keep their eye on either a pen that you're holding or the tip of your finger. You move your finger in the letter H, literally the letter H. That way you can hit all the corners and all the angles that your extraocular eye muscles can go to. Now, obviously, there are a lot of different eye muscles. Cranial nerve III, cranial nerve IV, and cranial nerve VI hit all of the H pattern movements. Of course, this only hits one muscle. So the way that you're testing this is really, if I'm addressing the right side of my eye, I want to see if my eye can track the medial torsion. Same thing, and vice versa with the opposite side. If I'm testing my left side, I want to see if that patient can go in torsion and medial. So essentially, you're looking for a very specific component of the H test for this cranial nerve assessment. I hope this made studying for Cranial Nerve IV a little bit easier. When you're studying for the NPTE, check out our courses at sptwithme.com. Check out these references for more information.